You're listening to 90.8 Hills FM Radio.
This is 90.8 Hills FM radio station, using our voice to rate your choice. Stay tuned.
Hello, everyone, and welcome back to 90.8 Hills FM. This is your Rj Gugu Haralu, and it is so nice to come back to the studio after many, many months. And I think I must thank our two speakers for prompting me to come back with this real talk over a new topic. And I hear that it's a very new, special conversation that it's going to turn out, because they're very sure that this is something that has not been spoken widely as of now. So they have taken this opportunity to be in the radio. And by the way, it's their first radio. So hooray for the inauguration of their radio presence. So dear listeners, I hope you find this beneficial as you continue listening. And this is something that we do at our community radio, making awareness, doing awareness, and also advocating on good, healthy life. So may I introduce Dr. Chenithung Ezung. He is an MD Physical Medicine and Rehabilitation from the Christian Medical College, CMC Vellore. He's a consultant currently at the referral hospital, which we commonly remember because when we say CIHSR, then they're like, is it the referral? So maybe I could tell the common mass people in reference, it's at the referral hospital. Alongside, we have Dr. Toshimenla Pongener, and I don't know, I am not a medical specialist, so excuse me when I say a certain, when I say certain medical terms which may not be right, but I would let the understanding of our medical practitioners here to correct me. So IPGMER and SSKM Hospital, Kolkata, Institute of Postgraduate Medical Education and Research is where she has done her studies. And today, both of them will be speaking on the theme Introduction of PMR Specialty, a specialty involved with patient-centered care, restored function, whole being approach. So we're really going to talk about, I think, with a holistic approach of an individual, of a patient. So I'm going to throw this conversation right on to Dr. Chenithung to talk about what is PMR.
Yeah, thank you so much, Gugu, for having us in the studio. And, well, it's my pleasure to be speaking on the physical medicine and rehabilitation. PMR, as the name stands, as I have mentioned it, it stands for Physical Medicine and Rehabilitation. So this physical medicine and rehabilitation basically focuses on the restoring the physical functional capacity of a person and empowering and enhancing the quality of life. And when I say empowering the quality of life, I also mean to say that we don't target only at the medical treatment, but we also go far beyond that, and we also look into the social aspect also, and also the vocational rehabilitation also. So this physical medicine and rehabilitation is composed of two parts. Mainly the first is the physical medicine, which encompasses the treatment, medical treatment, and also the involvement of the assistive devices also, which is used to correct the impairment or the disability or the pain that can lead to the debilitating the features in a person, and to apply that the knowledge and also the treatment in treating that very condition, so that the person can be restored of his or her own functions. That is about physical rehabilitation. Whereas this rehabilitation, it encompasses in enhancing, it overlooks the physical aspect, the psychological aspect, as well as the interpersonal the factor also. And ultimately, we work towards the field that I've just described, and so that targeting on the patient's condition, we work towards it and help them to reach to a potential where the patient can say that where we can feel that the patient can be independent of his activities of daily living, and so that he can either join his their earlier or previous work and at least come to a state of normalcy. So that's what physical medicine and rehabilitation stands for.
Okay. Well, that looks like I wish to know. Could you just share an example of a patient or what kind of patient comes to you that fits, it's referred to a PMR section?
So, physical medicine and rehabilitations, we see patients who have these physical impairments due to the brain damage, especially say like a patient coming to you like with after a stroke or after an accident and has sustained an injury on the head. So and also like impairment which is relating to the nerves, the bones, muscles, tendons and ligaments, so which can cause the disability
Okay.
or impairments.
Okay.
So everything that is related to it we see so that we can improve the function and the quality of life.
And is this a one-time thing, or there is a therapy session that goes all along? So is it case by case? And as we were discussing as I was opening the conversation this in the beginning, why do we say that this is a very new conversation right now in Nagaland?
Um, when I say it's a new and a unique specialty, I mean to say that like when a patient comes right to our OPD, we us like doctors are mainly concerned about the condition or that very disease, the condition of that person. We treat that person, we treat the condition, and once they finish their treatment and they're well, the patient might totally forget about the hospital, the doctor, and go back, and then we continue with the lives. But out here, we are dealing with a specialty which involves like like when we get in the touch with the patient, we know them for lifetime, because we are not just when we are not just focused on treating the patient, but also looks into the mental status of the patient, the social and the environmental factors, and also the patient participation in the society. So when we look into the patient, the whole this thing health system as such, and when we say about the disability of a person as such, we are looking into several components out here, and the ICF, which we call it rightly, International Classification of Functioning, they have divided into broad terms components, which involves a person's participations in the society, which also includes their roles and the responsibilities in the society and also in the family and community, and also their educational status and the employment, whether they're working or not. And also when we talk about this the bodily structures and functions, when we talk about disability, we are also concerned with dealing with the disability which can lead to the impairment in the functioning of the body structure. For example, say like in stroke patients, and which can cause a weakness on one side of the body or even in the lower limbs also. Or we say like we are talking about environmental factors. Say like the person after a stroke, once he sustains a stroke, it will all it also the society which he lives in also determine like whether the person can like participate freely or not, because all this kind of like the stigmatization will arise, and the person will have a second thought when he wants to participate. And also the environmental factors like the whether it's patient friendly for a particular condition.
Sure.
It becomes very important whether suppose a patient on a wheelchair, unless until they have a ramp or something which they can use it for taking the patient down even into the house, it becomes very difficult to be to say on a practical note. So
That must be quite challenging, right? Have you had some situations like that where patients have shared the difficulties or challenges and helping them to overcome such situations?
yeah, the one of the incident which I remember profoundly was one of the stroke patients. Stroke patients. Why I'm repeating again and again is that because this is one of the major conditions that we are seeing in us, even in our own state, and the impairments and the disability, they affect they bring upon the family and the person is immense. And when we treat a person, we are treating them not only from within the four walls of the house. We take into account the architectural, the barriers and the settings of of the patient, so that we can train him accordingly. So when he goes back to his house, he can easily adapt himself to the new the surrounding or the previous surrounding. So that was also one of the things that we would like to look into. And also one of the incident which I was relating was a stroke patient who was on a wheelchair, and they had said they were living in a like a story house, 2 or 3 stories, and they were living in the third story, the third floor, no lift. So after the stroke, they couldn't even climb up. So he had to shift down to the
Ground floor.
Ground floor, yes. And after that, they had no ramps, so it was quite difficult for them. And even to access to the toilet and all, it was difficult. So a small suggestion, building up a ramp, or putting a wooden plank just to enable the wheelchair to cross easily. And that was something that we just suggested, and they implemented it, and which made it much easier. And even in terms of transfer also from wheelchair to their own bed or to the toilet, it was much easier. So with all the trainings and with all the practical the issues that they come up on, it becomes easy to relate, and also to find out the new ways and how we can help them better. So that's one.
That's so good to know, Dr. Chenithung, because I think it is not just the treatment, but your approach, to their personal spaces. Because I mean, the medical treatment is one thing, but the state of mind, to enable them to actually be able to feel accepted, and the difficulties that they're facing, you hear them out, and you make sure that their environment is prepared well for them to go forward. Because these are little hinges, I think, that matters a lot for a patient. And unless we're in that person's shoe, it's very difficult, or perhaps we would say, don't be so finicky, or we might even say that, it's okay, but it may not be okay. So I'm quite surprised that it is not just the medical treatment you're looking at, but really looking at the well-being of the patient. Now I would like to take the opportunity to hear out Dr. Toshimenla. With the PMR, I would also like to know, what is your role as in terms of this practice?
Okay. Thank you, Gogo, for the wonderful introduction. And then it's been months that you've not been here, but then it's very nice seeing your face.
Thank you.
I belong to PMNR specialists, so we're also called by the term as physiatrists.
Physiatrist.
Yes.
What does that mean?
Physiatrist, just like a skin specialist is called dermatologist.
Yes, yes.
And orthopedician is also means like a bone specialist is also called orthopedician.
Okay.
We are also known by the other term, that is physiatry.
Physiatry. I
Yes.
gotta remember that.
Yes, definitely do. Okay. Ours is a very multidisciplinary approach, and then we involve with many of the other specialty as well, be it medicine, be it pediatrics, be it orthopedics. We are dealing with so many patients, because everyone after an injury or after a disabling condition, they do need rehabilitation. So basically, if it is just an example, since Dr. Chenithung has also mentioned, like in case of stroke patients, in case of spinal cord injury patients, all of them, they do need rehabilitation, because we have to bring them to their utmost and improve their quality of life, as well as improve their activities of daily living. So just like a simple thing, just like eating, just like cooking, just like going to the toilet, it becomes very difficult for them. We normal people, we take it for granted.
Absolutely.
But then when it comes to stroke patients and all, when one of their hand is paralyzed or one of their leg is not moving, so it becomes very difficult even for them to eat their food, comb their hair. So we help in the restoration function. We act as a whole, as a department. For us, we plan the according to the need of the patient. we plan what their goal is. We see the patient, we plan according to what their need is. It is usually patient centric. So we see their socioeconomic status, then we see whether they have good amount of caregivers, how is their architecture, and then how in what locality they are staying, and then after that we plan accordingly what the patient was doing, so that in future when they go back to the society they will have a vocational rehabilitation as well. Like when it comes to the hospital, it is an institutional based rehab, so we have a multidisciplinary team. So our physiotherapists, our occupational therapies, our speech and language pathologies, they come together. We try to restore the maximum ability of the patient, but eventually the patient has to go back to the community.
Correct.
They can't stay in the hospital for a long time.
Yes.
So basically when they go back to the community, there's lots of barriers. The hospital setting, everything is made, like lift, ramp, everything
Correct.
is there. But then India being a developing country, as well as Nagaland being so underdeveloped, with all the roads and the steps, it becomes very difficult and challenging for the patients. So for us, we don't see the patient as a patient, we see them as a person.
Wow.
So basically when they go back, we see into what architecture they were and what is their source of income, whether we can help them. Like we train the patient in developing small skills, like example, the patient is paralyzed waist down, but their hands are moving. So we train them how to do tailoring.
Oh.
So basically after that there can be a source of livelihood for the family.
You're also touching on the livelihood aspect.
Yes, yes.
Wow.
So we do have vocational rehab counselors as well. And when it comes to handling a business as well, they can always open a small tea shop because their hands are working. So basically they can be always in aid with an NGO and all. They can help, the society can always help them. But then in foreign countries and all, they are advancing, so they know all these things. But then for us, we are still lacking. And then for us, the sad thing about that is the patient is always bedridden at home. Even though they have potential, they don't know whom to go to, because they go to a specialist, they will prescribe medicine and they think that's the end. But then for us, we don't see the patient like that. We treat the medication. We see how much the patient can do in the society, or what will be best for him, the best possible independent thing. So that's what our specialty is about. So thank you so much for
Wow.
letting me give a wonderful time.
I think, Doctor, I think that's such a beautiful package. You know, I mean, it's from A to Z. You are so thorough with this particular care. You know, I mean, it's truly described. You know, the word care. I mean, you're looking at every details, micro details of your patient, and how you explained it so well in terms of their well-being. Something which I feel the government should be doing.
Definitely, they should be doing.
Yeah, because the way you described it, you don't mind falling sick, God forbid. But if such medical health care is holistically looked into of a patient, we feel safe to get sick. You know, whether it's by our own or by a sickness that comes to us without we being responsible. But what I'm trying to say, even for our listeners to understand, is that everybody says, you know, when it comes to medical in Nagaland, we don't know honestly, because we have heard so many cases of misdiagnosed and so on and so forth, and our faith, our hope, you know, that's something very far away when it comes to our medical health. So getting to hear both of you explaining this, and really this is happening in Nagaland and at the referral hospital, it's just touches my heart with so much of assurance, you know. So on that note, I want to focus more on what are the various services provided under the specialty, which you have already shared, you know, the different kind of, I mean, even to the detail of caregiving. even to the detail of the socioeconomic, status of the patient. I mean, to the extent of his architect. I mean, his house.
Yeah.
Is it, and also the background, so that you can give that patient, the right guidance as per his status. So we are not making a uniform condition. It is per case.
Yeah.
And that is so detailed and micromanagement that I feel that our listeners should be celebrating this information, that something like this is there in Nagaland. Because a lot of times we say that, oh, kali dun manuhi eniga facility power. But how you said that, you look at the person as a person, but not as a patient. Would you like to reiterate that?
I mean, when you mention the word like patient-centric, it brings me back to the day like when my dad was admitted in the ICU. He was down with some heart problem, and he had to be like ventilated, and he had to be admitted. By God's grace, he recovered after a few days, but the transition from ICU to ward was not very smooth. So we felt like if something could have been done during the time, during the duration, if his muscles could have been worked out, or if the tiny, the nitty gritty things could have been looked, it would have not been that drastic as such. Of course, he recovered from it.
Thank God.
But what I'm trying to like infer from this is like our specialty, like fills in, especially in this the situation. We go see the patient also in the ICU itself, critical cares and all. And as Dr. Aman had rightly said, when we talk about a condition, we try to know from a medical the perspective. Firstly, diagnose. Suppose we are dealing with stroke, we see and evaluate what kind of stroke it is, which kind of the brain it is affected, and accordingly the prognosis become very important. Whether the patient will be able to recover, or whether the patient will be dependent on the family members for some time, for a longer term.
True.
So that becomes very important. That's why we have to make a realistic plan as well as a customized plan for each of the patients. And our team, as she has rightfully said, the physiotherapies which will be involved in strengthening, I'm sure like everybody will be knowing about physiotherapies, but then comes occupational therapies. Occupational therapies is therapies which will be involved in training them with the skilled and the basic activities of daily living. It can involve the small things like brushing teeth, or grooming, or even wearing shirts and all.
Oh.
So after the stroke, it becomes very
Yes,
difficult for the person. So they will be involved with that, and also the ergonomics, the way the manner in which we sit, even at the workplace. We have back X-rays, like okay, and so we see the medical diagnosis, see the X-rays, see whether the problem lies with the backbone or the muscles and all. And if it is because of the muscles, we ask them to improve their posture. So this occupational therapies will jump in, and they will educate the patient about the correct posture, because we from the medical perspective, and correcting them that in relation to the biomechanics of the spine. So
Wow.
and also the prosthetic and orthotic again is there. So this particular prosthetic and the orthotics, the personal, he looks into the fabrications of the splints for supporting the arm, the legs and all. And also he can he fabricates artificial limbs, prosthesis we call it. So prosthesis basically stands for the replacement, whereas the orthosis stands for the support, or the splitting that we use. So it encompasses like a multidisciplinary team, and also the speech therapy, clinical psychologists, and even the vocational this counselor and social worker also comes in. So it's like it was quite difficult initially to start up with, but we are able to come to a place, and then we are able to work together as a team, and it's a great joy that we are here together, and we are here speaking on the radio.
I'm glad you both came, because what I really enjoy in the radio station is Well, definitely, this is not something that I've studied or anything. Having to speak to our resource persons on their special subject and what you specialize in. So for us, we benefit so much from the conversation, new topics, new information, and it makes us so aware. You know, just that we don't get an opportunity sometimes to come across. Oh, any gabi facility I say, I wish I knew. No? So the radio platform, being a community radio, it's a platform for people to share informations that would benefit everyone. And being a community radio, we've had the privilege of many resource persons, you know, with their knowledge, their skill, their case studies, and real life experiential learning experiences, you know. And with that note, having to hear with your personal experience, especially Dr. Chenithung, about your father when he was in the hospital and the transition. There's my question may sound very silly, but being a doctor, and this has been a very common, curious, you know, Dr. Manogan bi bimar hoy, na? Okay, that's, and since both two doctors are here in front of me, let me take the opportunity, you know. So how do you I mean, that's, you know, people's perspective that if a doctor is curing people's disease, right, irrespective of the specialty. So they will also cure their own disease, right? They don't have to go to the hospital. But what is your take on that?
Yeah, I think I was asked the same question by one of my colleagues. Why does a doctor get sick? I was standing in the pharmacy line.
Okay.
And then one patient just walked up to me and like he was just grinning and saying like, do doctors also get sick? And I said yes, very much. It's like basically we are at the forefront. Whether the patient comes with flu or any sickness, we're being exposed. Even though we wear a mask or we take the precautionary measures, still the chances of getting infection is at least 30 to 40% is there. So I mean it's there, and then we were also discussing that we get so much busy sometimes that we don't have a time to even check ourselves, to evaluate ourselves. We had this thing, the annual medical checkup recently. So we were also thinking like, we haven't had really a chance to, check ourselves and say that like, okay, we are doing fine. So, I mean, all these factors also play, and then...
Very much. Well, I guess all of us are humans.
Yes.
And we look at our doctors next to God, you know, someone who has all the solution. You need to figure it out. I think this is a very challenging profession, you know, and very heartbreaking at the same time. But knowing that you have the ability and the gift to heal, I think that's the biggest blessing that this profession can give. And we're glad to have you on a studio. So I want to go to the next question. My favorite, challenges. So what challenges both of you have faced, perhaps together or differently, that you can share with our listeners?
Give the time to
Now it's my turn. Huh?
choose the juiciest challenges.
Actually, when the thing is that many patients they come, okay, but then when they come, they're already have sought the help of so many people like quacks.
Quacks.
Quacks
You
is
mean
number one in last.
Koviraj.
Yeah, Koviraj. Yes, Koviraj.
Yeah.
Okay.
That's why I say Koviraj stands first, and then the orthopedician and the doctors.
They go to multiple healing centers as well. I
Yes.
don't mean to say that they're bad, but
Yeah.
then sometimes when there's a medical condition, the first responder should be a doctor, not the
Correct.
other way around.
Yeah.
There should be, for us also, we being a Christian, we do believe in God, but at the same time, I think treatment and prayer goes hand in hand, not
Correct.
the other way around.
Yes.
But because of so many ignorance, and then currently in Nagaland, there's lots of gossip going on. Someone will talk about something, the other person will go around and then say that person is good, that person is good. So
Hot
it becomes,
news.
yes, very hot news. So that's why they end up going to so many people.
Yes.
So that is one big challenge. So just recently, one patient had come to our OPD, and the patient had severe neck pain. So basically, the patient had gone to a Koviraj 3 days ago for the neck pain, which was there for 2 weeks. And when he came, I saw his gait, the way he was walking. It was not normal. And then after that, I asked him, what is your problem? He said, I'm not able to walk. My hands, there's like tingling and numbness. I'm feeling weak. And then I'm not able to hold things. My chappal is falling off my feet. So I examined him and I could notice that after manipulation by the gobiras in his neck, he had developed actually spinal cord injury.
Oh dear.
So that's the reason why they needed emergency surgical decompression. So there are some areas in our body that which might have to be looked over by a doctor rather than gobiras, especially the spine. Spine is one area which I would not want others also to be touched. Whether sometimes we go to a barber shop also because of ignorance, they do all that massaging with head cracking that we actually don't know what kind of injury
Yes.
is there. So for the other joints and all, usually it is the manipulation does help sometimes, but when it comes to the spine, if in case just for that 5 minutes or that 2 minutes of pleasure, if in case anything happens, just say 1 in 10 lakh population or 1 in 1 lakh population, it becomes very debilitating for the patients as well as the caregivers, and then that remains for the whole life. So that is one take on it. And they might think that we PMNR specialists are physiotherapists, but then we are not. We have done our MBBS degree. Along with that, we have done our post-graduation in physical medicine and rehabilitation. So the first responder is usually us. After that, after seeing the patient, then we allocate to the physiotherapy or the occupational therapy or speech therapy depending on what the patient needs. Because when it just a simple example, since stroke is very common in Nagaland,
True.
like when stroke
Sounds
happens,
so sad, yeah.
yes, only hand or only feet does not get affected, speech also gets affected, they have difficulty in breathing, so it's not seen as a whole by the physiotherapists, then it's seen by multi-component, multidisciplinary approach. So that's where we do the planning. So the first point of patient contact care is usually us. After prescribing the medication, after seeing that his vitals and everything is normal, then only we go to the therapy plan, whether it's short term and long term, because we know that it'll take a very long time to rehabilitate. If in case you have seen many of the stroke patients, most of them, they don't it's not that you give medicine and then they're alright the next day. It never happens.
No.
It never happens.
Yes.
And then because of many carelessness also by most of the patients, like they don't take medication regularly, and then they eat a lot of pork, fatty
Oh
food.
yes. So I think
So-
they'll.
Really loud.
Yeah, so
I got it.
diet is also one big factor. So, and then lack of exercises, because with this advancing age, we are usually sitting on our desk job doing all that job, so it becomes a very challenging and a difficult thing. So it's a little bit of ignorance from the patient's side, but at the same time they should know that we are there to help them. We are there to help them as a team till they recover to their maximum ability. So that's the reason why we're there.
Do you want to add something, doctor?
Yeah, I mean, she has touched a very important the points that I would have like to describe. But anyway, I think moving from that, like a little addition to what she has said, especially like the challenges and difficulties that I faced when I initially joined as the PMR specialist, was that it was difficult in convincing the family members for proper rehabilitation program as such. And when you say a rehabilitation program, we also want the patient to be consistent in what they're doing.
True.
And so, like, depending on the impairments of the body, the disability of the person, we ask them, and then we accordingly, like, there are two kinds of rehabilitation that we are dealing with. One is the restorative rehabilitation, which we know that like patient has a potential to come to a normal functioning state, and there is another state like the palliative rehabilitation, which which we work in order to improve the quality of life, maybe the pain, maybe the daily activities of living, and also its mental status and this other like the components related to it. So out here, what it becomes difficult is like the family members, because like all people, some people are very understanding, some family caretakers are very understanding, but many of our Naga society, because we are very simple minded people, and because like and the problem is that because like it's a new specialty in the state, and even in the country, compared to the other western country is fully it is widespread and people know about it, but out here, even in the country and in the state, people do not have much knowledge, even in the medical fraternity also. So when it unless until they see someone really having a good outcome from the rehab part, usually we don't buy that idea. So that's one of the challenges that we have. But after having mentioned the challenges, but I would also like to add the positive point also. One positive point is that like we had started we have admitted some few patients, and we had followed up, and actually we had like we had got a good outcome and a good the functional the restoration of the patient, and we can see that patient actually doing well.
Oh,
So,
wow.
yeah. So I mean, we get to see them back, because like they will come and report to us the way they are doing and how they are doing in their work, and also it's like a constant connection.
So you already built a relationship in the process
Yeah.
of his treatment or her treatment.
Mm.
I think that's wonderful.
Mm.
You know, to go back to your doctor, and even doctors getting to see their patient
Mm.
who sometimes become a dear friend as well. I mean, that's such a beautiful love and hate relationship between the patient and the doctor. I mean, for us also having quite a few doctors in the family, they would also come and share their challenging moments. And then we also get all the danda after listening, like, okay, we shouldn't become like that patient, and then doctors would not treat us. So they do share the frustration, and which is very normal, and one should. Because, like you said, Dr. Toshi, that about, people have already had so many hands done on them, and at last they'll come searching for the real doctor to fix it, nah? And then when you're not able to deliver as per the desire, the expectation, then they question your credibility. That sort of exchanges have happened, continues to happen. So, dear listeners, if you have, as you have heard Dr. Chenithung and Dr. Toshi sharing about their challenges, I think it's really important for us to be very wise and careful about our health, and not just throw it away for short term, pleasure. I think even in the medical context, the word pleasure also have its own connotation, and I think this is very important, because we really go to barbers, and we've seen all these YouTubes, how they do the wonderful cracks and the sound of the crack,
Yeah, it's very
but
satisfying.
but we don't know what it would lead to, a permanent damage to our body, and that's a very sad story. Yeah. And you were also talking about how stroke is so common in Nagaland, and that really pains your heart, you know. That's the thing. Why are people dying even in their sleeps? Why are young people having, stroke? Nobody seems to be talking about it, and the majority of the younger generation is getting more sick than the older generation, who happens to be living till 90s and 100, and we question, ourselves, whether we will even see the 70 years of our lives. So the specialty PMR, what is the scope here in the state, and how many are there? In fact, how did you both choose this subject?
Would you like to go first?
Okay, both of you.
For me, to start with, as a young graduate, I was very much interested in medicine. Medicine was like my top priority subject, but I had an inclination for improving my practical skills. That's when I went to a mission hospital. It was a mission hospital near Silchar, 1 hour drive away. So there I was exposed more to surgeries. And so I was like, I was okay to do any specialty, because I've been exposed to both. And the moment that I clearly remember was that I have been narrating the story all over again and again. This was like during one of our this evening. We used to go around from our evangelical union, go and pray for our patients, for the sick patient. And this was one particular Naga patient who was in his the terminal illness, and like as the young EU member, I was asked to pray, and that was my
Oh.
first time. And so like I managed to utter a few words, whatever I knew. I just blurted out, and then like okay, that was done, and we were leaving. And actually, as soon as we came out, then we were being informed that the patient had passed away. And my friend who was there was making fun of me, saying that like, okay, since you prayed, the patient died.
Oh dear Lord.
Yeah, but then I took it on a very positive notes, thinking that like, okay, fine, we are there in close contact with the patient, even at the last breath of their lives.
Yes.
I think we have a lot to contribute from our end also. So when I chose this specialty, I mean, when I first was like introduced to this specialty, I got everything like what I wanted. I got to do medicine. We do surgical intervention also to correct that impairments, and also we look into the mental and psychological aspect of the patient, and help them so that they can improve their quality of life. So it covered up everything. So right now, like I am very contented to say that like I have rightly chosen the right specialty, and I am very much satisfied working in that particular specialty.
Wow.
Yeah.
Thank you, doctor. And where did you do this?
Which one?
Your studies?
Yes, studies. I finished from RIMS Imphal, and then I went to a mission hospital called Alipur PMCH, Burroughs Memorial Christian Hospital. After that, I got a chance to do my specialty in the Christian Medical College, Vellore. That's where I finished, and I joined CHSR Hospital.
Wow, that's so wonderful. We just had a career guidance talk. Yes, definitely. This is amazing. So we're going to listen from Dr. Toshi. How did you get into this profession?
And so before that, Gugu,
Yeah.
thank you so much for articulating everything in like you being from a non-medical background, and then for the listeners, they must be like thinking, what is going on? But then for you, articulating and communicating in simple language and letting them understand, it's actually very wonderful.
Thank
you so
you.
much.
Thank
And
you.
then in regards to your question, I had actually chosen the subject not knowing it.
Oh,
like
wow.
in a
That's a
sense-
different one from Dr. Chenithung's case.
Initially, just like when in a market, when cupcake sells, everyone rushes to it. So
Ah.
everyone knows only about medicine, pediatric, obs and gynae, right?
Correct.
So I was also in favor of obs and gynae or pediatrics, but maybe destiny took a different turn. I got into around 2 colleges. One was like a Christian hospital sponsored one where I could get any of the seat, but at the same time under All India also I got PMNR subject.
Wow.
So the deadline was crossing, so I had to choose one. So I thought, okay, that's a very different stream, so let me just explore it and see what it has to offer. So when I went into this field, it was very wonderful that I could help the patients in many ways. It's not only it's not focused on only one thing. It's like a very vast pool, and then you can help the patients starting from your the hospital to their home, to
Correct.
their business, and then all along the way they become our friends.
Wow.
So that's how I felt very contented with what I'm practicing. Just that we have very few in numbers in Nagaland, and I think currently only Dr. Chenithung and both of us are practicing referral, and one is there, Dr. Imli, who's in Dimapur District Hospital.
Okay.
So only 3 of us currently in within Dimapur area, but as of now others, they might be choosing also the juniors and all, if in case they do like the specialty. I think in the upcoming years then we are yet to see many people choose this specialty.
I think I would suggest even to our listeners, if you have anybody who is interested in medical, should choose this, because just listening to both of you, the holistic approach is just so amazing. I mean, it's much beyond as a doctor to the patient. I mean, how involved you are in his or her affair. I mean, like literally, of course, Anagas are quite conservative when it comes to sharing their background, their details, but it is also the creative side of the medical practitioner, how he or she convinces the patient to open up if they want to get well. And I think our society is as such that majority of our patients are from the lower strata, right? And all hopes are gone, and the question of kun mo ki help kruwo. I'm already a disabled person. I can't do things on my own. Everyone is busy. I can't afford even a caregiver. These days, relatives are not even available. And to find a caregiver, even by payment, also, sometimes I've had this I face this situation with many people that we talk to or we meet. Me being an activist myself, the question of caregiving is such a high demand in Nagaland. It wasn't there before because big family, everybody took care of each other. But now everybody going into the working class, nobody has time, even for the little child. You often get to see in the society that, a child has 3 nannies. I mean, for God's sake. You know what I mean? So think about a patient. Now, not many nurses also likes to do caregiving. This is the sad side, and I've really questioned this, that why is it that nurses don't like doing caregiving work? Why do they want only hospital? Home caregiving is so high right now. Elderly people, like all these patients that you're talking about, God forbid, someday, all of us. And there's a huge market out there. We're talking about, again, another economic, where livelihood sector is also there. So it's a whole lot of a cycle that we're talking about. And I wish, with all these inputs that we get from all of you, it is also a career opportunity for people to specialize into something to fill those gaps, And I think I really want to say this, that I'm sure our listeners, whoever is listening, and the more you listen to this content, we understand better how things are also developing in the medical field, It may be very small and insignificant, but we have to start from somewhere. And at some point, with people's experiences, that's how word of mouth also travels faster than a text message, An experience that we have faced, whether good or bad, it travels faster, like we were saying, hot news on our copyright, Dadila hat to balasde, moi ki heel krish de itu khavide na. So something may work out, may not work out, but we often like shortcut and fast healing rather than going through the process and trusting that process because we're impatient ourselves, So is there anything else that we're missing out, that where you feel you want to talk about PMR?
The one thing that I would like to emphasize is on the one thing that I would like to emphasize is on the community-based rehabilitation. So we are not just focused in giving the care and treatment within the 4 walls of the hospital, but once the patient goes to their own house or settings, we also get a chance to follow them up in their houses. And right now, we haven't actively started out as such, but we have these community medicines in our hospital who goes out for the home visits and talking to the people, educating them about the non-communicable disease, and also like ask them to modify their lifestyles and all. And so like we had collaborated with them, and then in the last 2 years we had covered some parts of the Tanzaripar River, that region.
Acha.
And so we could get to go to see some of our own population, the patient population out there, and we could talk and interact with them, and then seeing them in their own setting is totally different story again, and the challenges faced. When we are training them, we are training them in our own control settings, but when the particular patient goes to their own community, it's again different story. So until we go and see how they're doing, it becomes like incomplete from our part also. So this is one of the things that we would be focusing and we will be targeting in the years to come also. There are many things required, because every organization, the particular the society has has a role to play in this. So be it the NGOs, be it the churches, be it the institutions, the schools, colleges, and all. Everybody has their own part. You can't say like we can't just sit back and say like okay, the doctors are supposed to do, or social workers are supposed to do, or
Correct.
NGOs are supposed to do, or the government is supposed to do. Everybody has to join hand, and we have to fight against the particular the conditions. And once we are able to do that, like for example, say like providing a simple thing like a ramp or some lift, even to board the buses and all for the disabled people, unless until the people raise their voice and expresses the need in order to establish that very particular the setting, even the government sometimes will fail to look into that. So it is our own duty as the common people. I think it's very important to identify the need, and also to raise the voice, so that like everybody, it will be a collective voice, and so that like the voice, once it comes together, it has a power to change everything. And so we want to work together like us as a team, so that like we can receive the help from all this the areas that I've mentioned, and also the most important is like church plays will need to play a very important role, because I think what I feel is I am not against the churches or anything, but when I talk about the churches, we have to be very practical. We talk about all this kindness. We talk about giving out, reaching out to the poor. But here we are dealing with the people who are literally, facing with the physical difficulties. And if not to help them, then whom to help? Reach out for the help.
Exactly.
So that these are the sort of questions that I would like to throw, and also ask our listeners and to just have a thought over it, so that when we go out, it would be a supportive kind of collaboration, and the help which will be coming from all the sides. The other thing is that I wanted to stress was that robotic rehabilitation is also one hot thing which has also come into rehabilitation part.
Oh,
So it's not just our own therapies or the other things who are involved, but now the robots have been introduced. So
at
it
the
w-
referral.
No, not at the referral right
Okay.
now, but then it has been introduced in one of the top centers like CMC Vellore, AIMS. They have
Oh,
introduced.
Wow.
So we are looking towards that kind of the change and the era where the robots will also be useful in aiding in especially in the restoring the function, the quality of life.
This is amazing.
Yeah.
Getting to hear, especially from both of you, with the change in the medical field, the evolution, the innovative approach to medical health for patients. I think this is just so assuring, because one can become very cynical, and the fear of even getting sick. Itu to aru, you get sick. The more you fear of getting sick, you get sick. And how mental health is so much part of this whole cycle. You were talking about the RAMs, you were talking about the disability. The word disability I'm able to associate with very personally is because my father has a knee, he's he has arthritis, he's an arthritis patient, and plus he used to have a lot of pain on his leg, and plus he was an athlete, and he started using crutches. And it was also for the first time as a family member, as a daughter, to see your father with two crutches every time walking out, walking in, can't climb. I mean, so many restrictions. You care and you're concerned so much that you don't want him to, strain. He can't drive too long, blah, 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 and the list goes on. And there was the other side where he doesn't want to be looked at as a disabled person, So it took some time, even as a family, to understand that transition. And when he gets angry, he says, I'm not a disabled person, I can take care of myself. Even while crossing the road, and he also met with an accident, just crossing the road, and he didn't remember he was hit, and he landed up in a hospital. And so being a stubborn person and a father that he is, we the caregiver is going through trauma than the person who went through trauma actually, So having being on this side, where majority of the caregiving that I do with my parents, you got to become street smart, you know. And I think it is for us as caregivers, when we are taking that role, these kind of information that you're sharing makes us feel much stronger that they're going to be in safe hands. Because we don't know what doctors do. Sometimes patients are very scared, or the family members who are caregivers are very scared to ask the medical practitioners or even the nurses, "Itu pichite kiniga hobo na? How long na?" Because it's not just getting the treatment, but it's also that how long the bills are piling up. You know, there's so many thousands of reasons that pops up into your head. More than the well-being of the patient, it's also like jolly kiniga shortcut kori kine khore jale bhalo hobo na? So there's so many things that goes inside the patient or even the caregiver majoritarily, you know. And the sensitivity is, I think, the word I wish to use in this whole conversation. The sensitivity and the profession, the special and the PMR specialist that you are. For me, it only reminds me of this word, sensitivity. You know, you're so sensitive to your patient, how you look at them as a person, and you treat them like a person and not like somebody who is totally broken. But you hold that to the brokenness, you know, and making sure in all aspect that he or she, whether short term, long term, you know, is taken care under your care. Wow, I mean, I just feel so spiritually, charged up, and especially coming from a mission hospital like referral. Because I've had a lot of people have said that they would rather go to a private practicing than to a mission hospital. You know, what's the difference do you feel? In fact, how did you land up choosing a mission hospital? Because a specialist like yours, I mean, like both of you, would have been much better in the cities. You know, why come back home? That would be my last question to end with.
Okay. Thank you for throwing that question. But before that, the previous question which you had asked, you have narrated a wonderful story about your dad. And then you being a common person as well as a caregiver from his end, actually what happens is the patient, they don't listen to the family members when they give advice. That's true for all. Okay, even if there's a doctor in the family, and then the doctor being the daughter or the son gives advice to the parents, they won't listen. But if in case they hear from someone else, like being a doctor, they do listen. So take an opportunity and take that advantage of coming to the hospital and then letting them know. And then, as you've rightfully said also, we do deal with, our specialists also deal with pain medicine, musculoskeletal pain medicine. Just like you've mentioned, arthritis. What happens is they have severe type of pain, and then sometimes they don't want to undergo surgery. So we do have options.
Yeah, that's my
related
dad.
with-
Who doesn't want to go for surgery at all, you know?
And some of them, they're adamant that they don't want to go for surgery. Is there any other solution? So we do help them get back. Because of their pain, they're not able to concentrate and do anything. So at least for us, we do do some interventions and all, and then help them at least reduce their pain at least about 70 to 80%, and then get back to their daily activities. Till how much we can do, we do. And then if in case surgery is needed and that's the last restorative option, then we give them. So just like that, there's lots of sometimes, just an example, frozen shoulder also, shoulder pain. So they have severe type of pain, but then you go here, then only medication is given. They don't have any options. They're not giving that cafeteria approach where they keep on saying that you can do this, that. But then for us, we explain to the patients what they're suffering from, and then what options you have. You can do this, or you can give an injection, or you can undergo this. So it's on the part of the patient what they want. We do not force them.
Too much of opinion, yeah?
Yes,
Of the patient.
I know.
My father would have chosen the least.
So since you had narrated the story, I was just coming and then talking in your context only. And then coming to the last question which you have narrated. Previously, I was working as a medical officer in referral only 2 years.
Okay.
Before I left for my post-graduation. So I felt it was a need to come back and then serve for some time till, let's see what
Till
happens.
you find another good opportunity to run away.
No. not
Just kidding.
that's not the answer to it. But then let's see, because actually Nagaland does not have a good rehab center, and then for that you need to push it only through the government.
True.
So referral is doing a wonderful job,
Absolutely.
like pushing the rehab one step at a time. But then the government also has to kick in, just like in Chief Minister Health Scheme or in Ayushman, it's not covered. So most of the patients who come are actually very poor, or most of them they discontinue treatment because of their lack of income.
Correct.
So that becomes a very big option. But unless someone goes to the government sector and then push it, then I don't think the change will be a long way to go, because it's not only about Dimapur and Kohima. There's all the other states also.
Yes, yes.
So we have to think about all those. So in that context, I like CHSR has always been my home, and then all the consultants out there are seniors and all, they're very wonderful. And then they've also just like the motto has said, serve, nurture and transform.
Yes.
So they've nurtured me, they've transformed me, and now I'm there to serve.
Woohoo!
So that's my take on it.
Beautifully said, Dr. Toshi. That's so wonderfully said. Yeah. Yes, Dr. Chenithung. What about you? What's your story?
Yeah, my story is also similar like Dr. Toshi's, because I was also doing serving as a medical officer out there before I joined my postgraduate. And also, like, after seeing the approaches, the visions, the way the consultants treat their patient, I was like very much like encouraged to work in such settings. It becomes much easier when you go to a new place. Again, it becomes difficult again to get adjusted to the new environment, new people and all, with their different thinkings and perspectives and all. But for me also, like, I felt at home at CHSR. So, and I feel like this particular hospital was a hope to the people in the hills.
Beautiful.
So I felt like, okay, and as Dr. Toshi has mentioned, pointed out rightly, we wanted, like, when we talk about rehabilitation as such, physical medicines we can even do practice, in a particular settings by ourselves privately. But when we're talking about rehabilitation, it's a multidisciplinary the team that is required, and for that to bring together, we need a big institution. And CHSR, if we felt like CHSR has the potential to bring all the multidisciplinary team under one roof and make it happen at the same time, with one purpose, that is to work for the benefit of the patient. So with this very thought, we wanted to approach to the government side, but the government side also, we felt like it will take a longer time. So if that had been initiated from the government side, it would have been much better. But then, since this is the only thing that we have got, we wanted to make best use of it. And so far, we have been getting good support from our hospital side. We are very thankful for that. Yeah.
Wow. I mean, truly speaking, what comes to my mind as I listen to both of you, we want to wish from the community radio 90.8 Hills FM, the voices of change starts from here. Where you dedicate yourself, you commit yourself to the mission, and not just the receiving end, but be part of that process. So we want to wish Dr. Chenithung, Dr. Toshi, and not to forget the other doctor, Dr. Imli, right? Since we only have 3 PMR specialists, am I correct?
At Dimapur.
At Dimapur.
Dimapur.
Do we have it in Kohima?
Kohima, yes. Dr. Vekho.
Dr. Vekho.
Yeah,
All
Vekho,
right.
and one of our senior is also working. One of our senior is also working.
Yeah, the mic.
at Mon district.
Wow.
Yeah, so he's also doing a good job, and we are looking for the new medical institution, which will be likely coming up. So if that happens, he will be heading the department. So we are very much happy for him.
This
also.
is just wonderful to know. Thank you so much for letting our listeners know, for our team to also know that something like this is there to serve, for people to come and use these facilities, and how rightfully said that it has to be from both sides. And we do hope that the government would have the heart the willingness to see the importance, and also wish to encourage all of you not to give up, because it's a mission in itself, and this requires a lot of resilience, to pursue, to see the light till the end of the tunnel. And it is here that we wish you the best in the profession that you're in, and may every patient that comes and gets in touch with you goes with a healing heart. So thank you so much.
Thank you so much, Gugu, for your time and for your wonderful words.
We are absolutely also blessed to know that Referral Hospital is doing so much in its own way, because people go to all different kinds of hospitals and they have different experiences. And for me, I'm very close to that hospital, because that's like a first and the end of the day, go-to hospital. But there's one thing that I appreciate the hospitals in Nagaland is that everyone is doing their best. So I think it's important for us to encourage from all sides, not just one sector. And how rightfully said Dr. Chenithung, where you said that everybody needs to come in. The community, the NGO, the specialists, everybody is needed to facilitate this so that we can have a healthy state. If people are healthy, the state itself is healthy. Well, listeners, it's been a great talk, and we hope that you have enjoyed, and we pray that you would think of someone, if you do come across, who would need such facility. So the go-to place that is at a referral hospital. At the we have the PMR section. It is in the OPD, but definitely the doctors would direct if a patient needs so. But just at the back of your mind, if you could remember to suggest or refer to anybody you feel that really needs and actually fits the criteria, you know where to go. And it is here that we want to thank Dr. Chenithung and Dr. Toshi for their time, and also explaining to us so very well in a layman's term what PMR is, who is it for, and what specializing it is, and why it is important, and the importance of this holistic approach on a patient's well-being, and how a patient is looked at as a person. For me, that's the biggest takeaway, that the person is not looked as a patient. Of course he's a patient, but how caringly the affair of the individual is taken care from the beginning till the end. So it is here with the voice of change that you have listened to. This is 90.8 Hills FM. Rj Gugu signing off, and hope to hear from you soon.
You're listening to 90.8 Hills FM Radio.
This is 90.8 Hills FM radio station, using our voice to rate your choice. Stay tuned.